Animal Health Trust in Newmarket, some of the country's leading veterinary surgeons treat and research illness in animals. Dr. Sue Dyson is head of the equine clinical unit here and one of the most respected vets in the country. In this programme, she will go through a range of common problems and give an idea of what can be treated by you at home and when the expertise of your vet should be sought. Sue is herself a former Pony Club member. She has instructed numerous branches, competes in horse trials, and has recently been involved with research projects into the effects of climatic conditions on competition horses.
It's very important that you learn how to recognise when your pony or horse is slightly off colour, because many of the simple problems you can sort out for yourself at home. You also have to know when to call the vet. In order to be able to recognise when the pony or horse is unwell, it's very important that you know what is normal. So what is normal? This horse is bright and alert, it's taking a good interest in its surroundings, its eye is wide open, there's no evidence of discharge from the eye, there's no evidence of any discharge from the nose. If I feel the pulse by putting my hands over the facial artery and timing for at least a quarter of a minute, I can learn what the pulse rate is. If you find it difficult to feel the facial artery, we can measure the pulse rate by putting our hand over the horse's heart and feeling the beat of the heart rate. We need to measure for at least 15 seconds to get a true reading. The normal horse's heart rate is about 36 beats per minute, but if the horse is excited, the heart rate may go up a little bit. We then look at the horse's hair coat. This horse has got a nice, bright, shiny coat. The hairs are lying nice and flat, very normal. If the hair coat is dull or the hairs are standing up an end, that's an indication that something may not be right. We then want to stand back and watch the horse's flanks move in order to measure the horse's breathing or respiratory rate. We want to look at the movement in and out and count the number of breaths per minute. And the normal respiratory rate of the horse is about 12 breaths per minute. If it's very hot, the rate may be a little bit higher than that. We look about the horse to see whether or not there's any evidence that it may have had diarrhea, and if we're in the stable, we can look at the consistency of the faeces. We also want to have been aware if the horse is urinating normally, whether or not it's standing normally to urinate, and whether or not the colour of the urine is normal. We must remember that there is a fairly broad range of the normal colour, from a very pale yellow to quite a dark brown, but any evidence of redness is definitely abnormal. One other very sensitive monitor as to whether or not your pony or horse is abnormal is whether or not it's got a normal temperature. So we need to measure the rectal temperature. The normal rectal temperature is in the range of 100 to 101 degrees Fahrenheit. That's about 38 degrees centigrade. One other important thing too as to whether or not the horse is normal is to whether or not it's eating normally. Did the horse eat up last night?
Yes.
So to recap, at rest, a horse's pulse or heart rate is 36 to 42 beats per minute. His temperature is around 38 degrees centigrade or 100.5 degrees Fahrenheit, and he takes about 12 breaths per minute. It's also common to see them resting one or other hind leg, as they spend much of their time sleeping standing up. But if you see them resting a front leg, you can be pretty sure there's something wrong which needs further investigation.
Well, now that we've established what's normal, I think it's important that we recognise that there are a number of serious problems that can be prevented. One of these is the disease tetanus. This is a disease caused by a bacteria which can enter the horse's bloodstream by a very small cut. The disease can cause rapid paralysis and death, and once the horse has the clinical symptoms, it's extremely difficult to treat successfully. So it's vital that we prevent this condition. And prevention is relatively simple. All you have to do is contact your veterinary surgeon and ask him or her to give the horse a tetanus vaccination. A single injection is not enough. The horse or pony has to have a series of injections. First, a primary injection, then a booster injection 4 to 6 weeks later, and then annual boosters thereafter.
To vaccinate against tetanus and equine influenza, you need to give a primary injection, a booster injection 4 to 6 weeks later, and annual boosters thereafter. It's also very important to keep a record of these vaccinations so that if your horse changes hands, you can pass on an accurate record of when he was previously vaccinated. This applies for both tetanus and equine influenza.
So we can very simply prevent this disease, but it is your responsibility to contact your veterinary surgeon and ask him to give these vaccinations. Other conditions which can potentially be prevented are those associated with worms, and these include colic, diarrhoea, and weight loss. The horse acquires infection by eating the worms from the pasture, and the worms then develop in the horse's gut and are excreted in the horse's faeces.
If your horse looks very poor despite regular worming, your vet will probably organise a worm count. This enables him to find out the quantity and type of worm by taking a sample of droppings for laboratory testing. The worm count is made by counting the number of eggs per gram in the sample. The vet will then advise you on the next course of action. Bots lay their eggs on the horse's coat, often on the long hair down his legs. If you see the eggs, which are small and white, pick them off because the horse can lick and swallow them. Once they're in the gut, the eggs hatch and the larvae attach and feed on the lining of the stomach, which can lead to digestive problems and even stomach ulcers.
But we have to accept that a certain number of worms will be picked up by the horse, and therefore the horse requires treatment. And this is simply done by administering a worming drug. And we can do this either by giving a powder in the feed or alternatively administering a paste. The saying, "no foot, no horse," could not be more true. Many lamenesses are related to the horse being inappropriately trimmed or shod, or there being too long an interval between the times at which the horse or pony was trimmed and reshod.
You'll know when your horse needs reshoeing, as there are clear signs. The clenches may have risen and stand out from the wall of the foot. The foot may have grown over the edge of the shoe, or the shoe may have come loose or even come off. Another indication is if the shoe has worn very thin, particularly at the toe.
We can see here an example of a horse which definitely does need trimming and reshoeing as soon as possible. Here on the outside we can see one of the consequences of the hoof wall overgrowing the shoe. The shoe is actually beginning to sink into the horse's foot, which will unquestionably predispose to the development of corns. And if we move to the hind foot, we can see one of the other consequences of hoof wall overgrowth, and that is these longitudinal cracks in the hoof wall.
Let's just recap. To prevent the problems Sue has talked about, you must regularly tend to your pony's needs. Keep his feet in good condition by reshoeing every 4 to 6 weeks. Worm him about every 6 to 8 weeks. And make sure he has a combined flu and tetanus booster once a year. To be able to give effective treatment for minor wounds and injuries, keep a good first aid kit close at hand. You'll need plenty of poultices like animal Lintex and an array of different dressings and bandages. Have a stock of gamgee, surgical tape, cotton wool, and a pair of nice sharp scissors, not to mention a thermometer. And it's a good idea to have some basic farrier tools, just in case you have to take a shoe off yourself. Remember, keep the cabinet high up, out of the reach of children, or lock it, but keep the key close at hand in case you need it in a hurry. Antiseptic creams and sprays are useful for treating minor cuts and grazes, and a good wound cleaner like Hibby Scrub should also be at hand, and a stock of witch hazel which takes out bruising. It's a good idea too to put together a small first aid kit to keep in your lorry or trailer. You can get one already made up from the Pony Club, which should have everything in it you'll need. Keep the name, address and telephone number of your vet in an obvious place at the stables or near the phone. So if you need to call him in an emergency, you don't waste valuable time hunting around for the number.
Hello, this is Sarah Jones here.
Speak clearly, giving your name, address and the symptoms your pony is showing.
I was just wondering whether the vet could come as soon as possible. Yep, Forest
Also
Farm.
give clear directions to your stables and try to get an approximate time for his arrival so that you're ready for him.
20 minutes, yep, that's lovely. I'll be waiting at the stables. Thank you very much. Bye.
We've already talked about the importance of knowing how your horse or pony behaves normally. Nikki tells me that Gert didn't eat up last night, whereas normally she has a very, very good appetite. And although she looks bright and alert, that doesn't mean she is normal. And it's very important that we establish what might be wrong with her. One of the best indicators as to whether or not there is some underlying illness is whether or not the rectal temperature is elevated. So we're going to take her temperature by inserting the thermometer into the rectum.
To take a horse's temperature, first shake the mercury down in the thermometer. Of course, if you have a digital one, you won't need to do this. Then grease the bulb end and gently insert into the rectum. Keep hold of it and remove after 1 minute, or for a digital thermometer, the correct time indicated on the instructions, usually about half a minute. Don't hold the bulb end as you read it, otherwise the temperature of your fingers will make it rise. Anything 1 or 2 degrees above the normal means a potential problem.
The thermometer reads 38.5 degrees centigrade. That's a significant elevation and means that something is not right. So it's very important that Gert doesn't get work today and that we seek professional advice, so we need to call the vet. And we also must reduce her food intake, cutting down the amount of carbohydrates and protein that she's receiving. If the temperature had been normal, that wouldn't necessarily mean that the pony was normal. We needed to monitor the pony carefully throughout the day, taking the temperature several times over at about 2-hourly intervals and observing the horse or pony for other clinical signs indicative of a problem, such as colic. If you're in any doubt, call the vet. Don't forget that the earlier we make a diagnosis, the more likely we are to be successful with treatment. Nikki tells me that Gert, who had a temperature yesterday, today has diarrhoea. Diarrhoea can be caused by lots of different things, just by the horse being excited, or by eating lush pasture, or by a change in the diet. But it can also be caused by more serious things.
It is important to isolate any horse that you think might have an infection, for example, a cough or cold, a virus, or any catching skin problem like ringworm, as these are potentially transmittable, not only to other horses, but also to people.
And therefore it's very important that we set up an isolation box. You can see that I've already put the sign on the stable door, and now I'm going to put my wellies on before I go inside. For isolation, the horse should have its own equipment, its own grooming kit and its own head collar, clearly marked. You can see here that we've wrapped blue tape around the grooming kit box and the head collar so that everybody in the yard knows that this equipment is to be used for this horse alone. We should also have separate mucking out equipment and, most importantly, a tray full of disinfectant, and everybody who comes out of the stable must walk through this tray of disinfectant. Let's go and look at the horse now. We can see that Gert has already started to soil her buttocks, and therefore I'm advising that Nikki bandages up the tail to keep the tail hairs out of the way. I'll then suggest that she applies Vaseline to the buttocks so that we avoid the faeces resulting in scalding. We need to think about other aspects of nursing care as well. The horse needs to be kept as warm as possible, and rather than close the top doors, we should provide extra warmth by putting on an extra rug and perhaps also thinking about applying stable bandages as well. Because the horse isn't working, we also need to reduce its food intake, and good quality hay should be sufficient.
Remember, if you bring a sick pony in from the field and add rugs and bandages to keep him warm, when he is fully recovered, you must gradually reduce the amount of rugs he's wearing. Because if you just put him back out when he's well again, the sudden change in temperature could give him a chill.
One critical factor is that by the production of diarrhea, the horse will be losing a lot of fluid, and it's vitally important that it maintains adequate hydration. Therefore, you should monitor the amount of water it's drinking daily, count the number of buckets that are being consumed, because if it's not drinking enough, then your vet will have to administer additional fluids intravenously.
Again, let's just recap what you should do if you suspect there's a problem. Take your horse's temperature, and if it has risen, then isolate, making sure to use separate grooming kit, rugs and utensils. Keep him warm with rugs and bandages and monitor the amount he drinks. Don't forget to reduce his hard food, because he is not going to be working.
There are several potential causes of coughing in your horse and pony, some of which are serious and some of which are not. Regardless, it is important that you call your vet so that he or she can determine the cause. In the interim, don't work the horse or pony because that could make the problem worse. There are several potential causes of coughing in your horse and pony, and those include a viral infection, a bacterial infection, an allergy to the fungal spores found in hay and straw. This horse is very bright and alert. It has a clear nasal discharge, no evidence of filled legs, a normal rectal temperature. We can see that he's being fed dry hay, and the most likely cause of his problem is an allergy to the fungal spores found in the hay. Regardless of the cause, there are a number of principles that we should follow if our horse does have a cough. Firstly, we should either feed the hay after liberally soaking it, or we should switch to feeding horse hage in order to reduce the contamination of the fungal spores. Secondly, if it's cold, we should keep the horse warm by putting extra rugs on rather than closing up the windows and doors, because good ventilation is very, very important. We should also continue to monitor the horse's temperature just in case that it does have a low-grade infection. But regardless, it's very important that you do call the vet and seek his advice.
You may be faced with the situation when your horse or pony is reluctant to move, either out of the stable or in from the field, or if you're out riding, it may become progressively stiffer and then refuse to go forwards any further. There are a number of conditions that can cause this type of behaviour, and those include severe lameness, for example laminitis, or colic, or tying up, also called azoturia. This condition, tying up, is much more likely to be the cause if the horse seizes up whilst you're out on a ride. The symptoms associated with these conditions can be very similar and therefore confusing. And it's absolutely vital that you seek the advice of your veterinary surgeon. It's also important not to try to move the horse or pony from where it is, because that may make the condition much worse.
A common cause of laminitis is too much lush grass, particularly in spring, and is a swelling of the sensitive parts of the foot. As it is encased in the hoof, there is no space for the lamina to swell, so the foot becomes very hot and sore. A pony with laminitis will stand on its heels to relieve the pressure in the feet, and will look as though it's leaning backwards. Walking is difficult. Cold hosing will bring some relief, but you must take the pony off rich grass and carefully monitor his diet. Ask for your vet's advice on further treatment. A telltale sign in a pony that's had laminitis are the presence of rings in the wall of the foot that spread out at the heel. Beware, once a pony's had it, he'll be prone to getting it again. Colic is one of the illnesses that most of us will probably see at one time or another. There are many causes, but common ones are working the horse before he's had time to digest his food, feeding too much hard food when he's too tired to digest it properly, or rapid changes in what you're feeding. A horse with colic will look generally dejected. He may be sweating, breathing much faster and shallower than usual. He may also be looking round at his stomach and trying to get down and roll. As soon as you notice the symptoms, take any food out of the stable, but leave his water. Make sure there's plenty of bedding, because he'll probably lie down. If the symptoms go on for more than 20 minutes, call the vet.
However good your management is, horses are accident-prone creatures, and sooner or later you're going to inevitably have to deal with a cut. A small superficial graze on the side of the forearm like this is something that you can readily cope with yourself. But there are situations when you need to seek veterinary advice. If the cut is near a joint, for example around the front of the knee or around the front of the fetlock, or is close to a tendon sheath, such as the tendon sheath that runs down the back of the fetlock and right down the back of the pastern, then you must seek veterinary help, because if these vital structures are damaged, then you may get secondary infection, which can be very difficult to control unless it's treated immediately.
It is important to call the vet if the wound is on or close to an important underlying structure, such as a tendon or tendon sheath, or if it is close to a joint. If it looks very deep or dirty, then your vet will be the best person to clean it to make sure that the healing process starts from the inside, so no dirt is trapped, which will cause an infection. Stitching can help healing, especially in the case of a big or deep wound, but it must be carried out by your vet as soon as possible.
I mentioned previously that continuous steady bleeding is generally not a problem. You're not to panic, because that bleeding will stop spontaneously. If the blood is bright red and actually spurting, then that probably indicates that an artery has been damaged, and it may be helpful to try and stop that bleeding. The easiest way to do that is just to apply some firm pressure. Take a big wad of cotton wool, hold it on with firm pressure for at least 5 minutes. It may be helpful to apply a bandage over it subsequently and leave it in place for a longer period. We can use the same principles of management for any wound. Firstly, we want to trim up the hair around the wound. The reasons for this are twofold, really. Firstly, we want to be able to see as best we can the full extent of the injury. Secondly, we want to make sure that there are no hairs dangling in the wound, because hairs in the wound can predispose to infection and they can also delay healing. We can clean the area better having removed the hair, and all you need is a pair of rounded-ended scissors that are reasonably sharp. Once the area is adequately trimmed, we then need to reduce the gross contamination of the wound, and that's best done using a hose. So Nicky starts with a hose running over the bottom of the horse's leg, waiting for him to get accustomed to it, and then slowly moving the hose up the horse's leg until he will accept it running over the wound. And then we want to leave it on the wound for several minutes to try and get rid of as much of the gross dirt as possible before we then go on to finer cleaning. Hosing is of many benefits. Not only will it reduce the gross contamination, but it will also cool the area and help to reduce any inflammation and pain.
Cold hosing a wound does a lot of good. It cleans out any dirt, which in turn reduces the chance of infection. It cools the affected area, helps to take down some of the swelling, takes out bruising, and reduces the pain.
The next step is to more thoroughly clean the wound using an antiseptic scrub, such as Hibby scrub, which you should have in your medicine cabinet. So what Nicky needs is clean cotton wool, a bucket of warm water, and that should be a jolly clean bucket kept just for this sort of purpose, and the Hibby scrub. Once the wound is thoroughly cleaned, what do we do next? There are a number of commercially available antibiotic powders and creams, but I don't think these are really of great benefit. In fact, the creams can encourage further dirt to stick to the wound, which may result in secondary infection. With a wound in the upper forelimb, as we have here, it will probably heal spontaneously without any further treatment at all. If we have a wound in the more lower part of the limb, then it's important to keep it clean, prevent further contamination. So therefore it's useful to apply a bandage. This should overlie a sterile, non-adherent dressing such as melalin, which you should have in your medicine cabinet. The bandage will need to be reset daily, but after a couple of days you can probably leave it off, and this will enable the wound to dry out and heal of its own accord.
Cuts in the mouth are usually due to an ill-fitting bit. This is easily treated by washing the mouth out with salt and water and not riding again until it's healed. Then a bit of the correct size must be used, otherwise the same thing will happen again.
With any wound, there is always a risk of tetanus. If there is any doubt whether or not the horse has been vaccinated previously, then do call your vet and he will come and give both antitoxin and a booster vaccination.
Sometimes horses develop widespread skin lumps throughout their entire body, literally overnight. These are generally a hypersensitivity or allergic type reaction as a result of the horse having eaten something, come into contact with something, or something having been injected. This isn't a serious problem, and usually these lumps disappear within 24 to 48 hours, but should they persist, I suggest you call your vet. A potentially more serious problem is that of ringworm. This horse has typical lesions, these well-circumscribed areas of hair loss and rather scaly skin. These are caused by a fungus, and this fungus is potentially transmittable both to other horses and to you. And it's for that reason that the condition is serious. It is advisable to contact your vet because he can recommend to you the most appropriate treatment, both for the horse itself and to limit spread to other horses. But it is vital in the interim that you treat the horse as an isolation case. And it's particularly important that you avoid using the same grooming equipment or the same tack on any other horse at all. Some skin conditions cause your horse or pony to rub a lot. One of those is lice. Lice are small, pale-coloured parasites that we tend to find buried deep in the mane or in the tail, and you can see them moving around. They're easily treated by the application of louse powder, which you can easily get from your veterinary surgeon.
It's a good idea to wear a mask so you don't breathe in any of the powder, and only delouse in a well-ventilated area. Also wear rubber gloves. Apply the louse powder liberally and rub well into the roots of the hair.
This can occur at any time of the year, whereas sweet itch is predominantly a problem that we see in the summer months and affects ponies much more frequently than horses. Sweet itch causes very intense irritation and profound rubbing, resulting in marked loss of the hairs from both the mane and the tail and from the top of the tail. This is caused by biting midges and a hypersensitivity or allergic type reaction to their bite. These midges are particularly active in the hours around sunset and sunrise. So one of the management techniques that we can adopt to try and control this condition is to bring the horse and pony in from the pasture in the 2 hours preceding and following sunrise and sunset. It's also very useful to apply insect repellents to the horse and to the stable environment as well. In order to try and control the irritation, local application of benzoyl benzoate is often very helpful as well. If these control measures don't help sufficiently, then I think you should call your vet, because he will be able to administer injections which may be able to control the rubbing behaviour rather better.
Good boy.
Lameness is an abnormality of gait characterised by either an irregularity of the rhythm, an abnormal shortness of the stride length, or an asymmetry of the limb movement. Obviously, before we can appreciate what is abnormal, i.e. lame, we have to know what is normal and what the variation of normal is.
The trot is a 2-time pace. There are 2 beats to every stride. The beat should look and sound regular and even, and the horse's head and neck should be still, not nodding up and down.
I think it's helpful when we're trying to assess whether a horse is lame or sound to see it move towards us, past us and away from us. Can you trot again please, Nikki? If we listen to this horse, we can hear that it's landing slightly more heavily on one front foot compared to the other front foot. If you watch carefully the movement of the head and neck, you can see that the head and neck are moving up and down. And if you try to coordinate that movement with the limb movement, you can see that as the horse lands on the left front foot, the head and neck go down. This indicates that the horse is lame on the right forelimb. So as the left foot comes down, the head drops, and that indicates to us that it's a right forelimb lameness. I think it's helpful if we're trying to assess whether or not a horse is lame behind to see it move both at the walk and at the trot, because at the walk the sequence of footfalls are much slower than at the trot, so that gives us more time to assess the length of stride of each hind limb and the height of the arc of the foot flight of each hind limb. The horse which is lame behind tends to take a shorter length of stride with a lame limb compared to the opposite limb. And often the height of the arc of the foot flight is lower, and that means the horse may actually drag the toe, and that's something that not only can we see, but we can also hear as well. And that's very helpful to us. The rhythm may also sound irregular. Another important feature to watch is the movement of the hind quarters. The lame limb hind quarter tends to move more than the opposite hind limb, either due to an increased lift or due to an increased drop, or both. We can see that this horse is consistently dropping lower on the right hind quarter compared to the left hind quarter, which indicates to me that it has a right hind limb lameness. If we also watch the movement of the entire limb as it's advanced, we can see that the right hind limb is being swung outwards as it is advanced to avoid full flexion of the hock and stifle. Having established that the horse or pony is lame, or you're not quite sure, I think it's important that you call the vet sooner rather than later, because the sooner a correct diagnosis is made and the most appropriate treatment is started, it's more likely that the lameness will resolve quickly. I think it's also important to be able to give your vet some information about the lame limb so that he can gauge whether or not this is a real emergency. So we want to systematically feel the leg, trying to detect any areas of obvious heat, pain or swelling, bearing in mind that we can compare with the opposite limb if there's something that we're unsure about, feeling the limb not only in the weight-bearing position but also with the leg lifted off the ground, looking for areas of heat, pain or swelling, bearing in mind that there are some areas of swelling that actually may be unrelated to the lameness and are a total red herring. Having established that the horse or pony is lame, I think it's very important that you don't work the horse anymore, because there are some causes of lameness, such as damage to a tendon or a ligament or a possible fracture, that could get much worse with exercise. So put the pony or horse, if at all possible, in a stable until your vet arrives, or if that's not possible, confine it to a very small paddock. There are some problems which are real emergencies for which you must summon attention as soon as possible. And one of those is if your horse or pony has trodden on a nail. If that's happened and the nail has come out, it's very important in order to help your vet to mark where the nail was. So if we come and look at the foot, if we mark with an indelible pen where the penetration was, that will help your vet to try and establish whether or not any vital structures may have been penetrated.
Ideally, if the nail is still in the foot, hold the foot up until the vet arrives, as this will allow him to see where and how deep the nail went in. If it has to be removed or it falls out, tub the foot until the vet arrives to stop any more dirt and infection getting into the wound. This is easily done by cleaning the foot, adding a handful of Epsom salts to warm water in a bucket without a handle, putting the foot in and keeping the water moving around so it gets well into the wound.
Another obvious emergency situation is if you suspect your horse or pony has sustained a fracture. The lameness will have been sudden in onset and severe. The limb may have an abnormal shape with a lot of swelling. There may be abnormal movement of the bone or an unusual grating beneath the skin. If you suspect there may be a fracture, it's vitally important that you keep the horse or pony as still as possible. Either hold it where it is or keep it in the stable. If it involves the lower limb, then apply a heavy bandage. But above all, call the vet as soon as possible. This is a real emergency. Another potential emergency situation is if the shoe has become moved so that one of the nails is in danger of penetrating the sensitive laminae. If that has happened, then we must remove the shoe as quickly as possible. It's very useful to know how to remove a shoe, especially in an emergency situation. Although traditionally people have used hammer, buffer and pincers, it's actually much easier, especially if you're a beginner, just to use a rasp and pincers.
Sue is rasping the heads off the clenches so that the shoe can be pulled off without tearing the foot. It's not actually as easy as Sue makes it look, so if you can persuade your farrier to give you a lesson or two, it could be very helpful.
Most forelimb lameness is associated with pain arising from the foot, and there are a number of very common causes of this, one of which is nail bind. This is a condition that we generally see in the horse that has been very recently shod within the last several days, or if the shoe has become moved. This results in pressure by the nail on the sensitive laminae, resulting in mild to moderate lameness, which is particularly severe as the horse turns, especially on a hard surface. We can generally identify the offending nail by seeing the reaction to banging the foot over the nail. Treatment is by removal of the offending nail or nails and then poulticing the foot for 24 hours to try and prevent any secondary infection. It is important to treat this condition early because the longer the nail has been in place, pressing on the sensitive tissues, the longer the inflammation is likely to persist and therefore lameness. Another very common cause of lameness associated with the foot is due to an accumulation of pus in the foot. And this can cause excruciating pain because you have a build-up of pressure within the horny hoof capsule. The infection develops due to bacteria getting into the foot, either via a crack in the hoof wall or sometimes due to bacteria circulating in the blood. Generally, the horse is very lame and the whole lower limb may become diffusely swollen. The foot may be hot, and generally, if we apply hoof testers to the foot, we can identify a focus of pain and then pare away the overlying tissues to release the pus.
You'll need to get your vet, or possibly your farrier, to pare away the foot to release the pus, then apply a foot poultice. This new equiwelly is a wonderful way to protect the damaged foot and stop it getting infected any further.
Corns are just a fancy term for bruising, deep-seated bruising. We can see bruising in other areas of the foot due to the horse standing on a stone, for example, on the sole in this region here. Lameness associated with a corn can be very mild and often is only evident with the horse working on a circle, especially on hard ground. The treatment of corns is by paring away the overlying horn in order to relieve pressure from the underlying tissues. So with all of these causes of forelimb lameness associated with the foot, obviously it's important to call your vet so that he can carry out the most effective treatment as soon as possible. Mud fever and cracked heels are really different names for very similar conditions. A problem that we see in both stabled horses and in horses kept at pasture. And it can occur just in one limb, two limbs, or sometimes all four limbs. The problem is caused by soil irritating the back of the pastern and then secondary bacterial infection developing. The area on the back of the pastern becomes swollen and inflamed and may actually exude serum through cracks in the skin. Treatment is by clipping away all the hair around the affected area and then thoroughly cleaning the area and applying an antibiotic and corticosteroid cream.
Don't be too hasty about trimming the excess hair off a pony that lives out, unless they already have mud fever that needs treating, because the feathers do give them protection against the wet and mud. To prevent mud fever and cracked heels occurring, wash any dirt and mud off the legs after a ride or when they have come in from the field. Thoroughly dry the legs with a towel and apply Vaseline to stop the heels cracking. The best prevention, though, is to try not to put them out in a muddy paddock.
Another condition which we must consider is thrush. Thrush is an infection within the foot caused by the tissues around the frog dying and then becoming secondarily infected. It's a condition we generally see in stable-kept horses and is a result of poor hygiene. The horse is generally kept on a deep litter bed and the feet are irregularly picked out or not picked out well enough. Horses with very long toes and deep frog clefts are particularly predisposed. The condition is fairly readily treatable by trimming away all the dead tissue and carefully cleaning the area and applying a topical application of something like Carafax. It's also a condition which is easily preventable through good hygiene. That's keeping the bed clean and thoroughly picking out the feet on a regular daily basis. Obvious lumps and bumps may not be associated with lameness, and horses quite frequently develop one or more diffusely filled legs without any associated lameness, and this frequently resolves spontaneously within 24 hours or so. However, swelling in the cannon bone region, even unassociated with lameness, can herald a significant problem. For example, the horse may have sustained relatively serious damage to one of the flexor tendons and still be sound, but have filling in the cannon bone region. We've already discussed other causes of filling in the cannon region, which included pus in the foot and cracked heels. And therefore, if your horse does have swelling in this area, which persists for more than 24 hours, I do think you should seek veterinary advice.
If your horse does have an unexplained swelling, seek your vet's advice before applying a poultice, as this may make his job more difficult by temporarily removing important clinical information which is helpful for diagnosis. If you are to treat it yourself, first cold hose the affected area and then apply a poultice like animal Lintex. Prepare this by cutting a piece big enough to cover the swelling and pour on boiling water that has been allowed to cool. Make sure it's not too hot and then put onto the injury. Cover with plastic to keep the heat in and stop the bandages getting wet, and hold in place with a stable bandage, vet wrap or other similar bandage. Beware, however, if you do use vet wrap bandages, it's easy to put them on too tightly, which can cause more damage. Don't forget to support the good leg with a bandage too.
I believe that establishing a good relationship with your veterinary surgeon is very important, because then he's more likely to respond to your problems quickly and more effectively. I think it's important that you recognise problems early on, and that means being very aware of your horse's normal behaviour and the normal appearance of your horse's limbs. Remember too that many conditions can be prevented. For example, vaccination can prevent tetanus. Veterinary care is potentially expensive, and you must be aware of this in advance. And it's worthwhile considering taking out an insurance policy for vets' fees. Finally, remember that your veterinary surgeon won't mind being called out unnecessarily, but if you call him out too late, it may be impossible to resolve the problem satisfactorily.
You will find several useful chapters under the heading Veterinary Notes in the official manual for the Pony Club, the Manual of Horsemanship. Read as much as possible on the subject, and if in any doubt, never be frightened to ask for advice. Your horse can only benefit from your increased knowledge, and he'll be sure to repay you many times over.